Welcome all of you my YouTube channel. This video I am going to talking about meningitis. First of all, if you are not yet subscribed my channel, please subscribe it. If you have any questions, please leave a comment. Meningitis is an inflammation of the meninges, the protective membranes covering the brain and spinal cord. It can be caused by infections with viruses, bacteria, fungi, or parasites, and it can also result from non-infectious causes such as certain medications, autoimmune diseases, or cancer. Meningitis is a serious condition that can lead to severe complications and requires prompt medical attention. Causes meningitis can be classified based on its cause. 1. Bacterial meningitis. This is the most severe form and can be life-threatening. Common bacteria causing meningitis include Neisseria meningitis meningococcus, Streptococcus pneumonia pneumococcus, Haemophilus influenzae type B Hib, Listeria monocytogenes. 2. Viral meningitis, usually less severe than bacterial meningitis and often resolves without specific treatment. Common viruses include enteroviruses, herpes simplex virus, varicella zoster virus, mumps virus, HIV. 3. Fungal meningitis, less common and typically occurs in individuals with weakened immune systems. Fungi that can cause meningitis include Cryptococcus, Histoplasma, coccidioids. 4. Parasitic meningitis, rare and usually caused by parasites such as Naegleria fowleri, commonly referred to as the brain-eating amoeba. 5. Non-infectious meningitis can result from conditions such as certain medications, autoimmune diseases, for example lupus, cancer. Symptoms. Symptoms of meningitis can develop suddenly and may include fever, severe headache, stiff neck, nausea and vomiting, sensitivity to light, photophobia, altered mental state, confusion or lethargy, seizures, rash especially in meningococcal meningitis, cold hands and feet, limb pain, pale or mottled skin. In infants and young children, symptoms might also include irritability, poor feeding, bulging fontanelle, the soft spot on the head, and unusual crying. Diagnosis. Diagnosing meningitis involves several steps. 1. Clinical examination, assessing symptoms and physical signs. 2. Lumbar puncture, spinal tap, analyzing cerebrospinal fluid CSF for signs of infection. 3. Blood tests, to detect bacteria or viruses and to check for signs of inflammation. 4. Imaging, MRI with CT scans to look for brain swelling or other complications. 5. Polymerase chain reaction PCR testing, to identify viral DNA or RNA in CSF or blood. Treatment. The treatment of meningitis depends on its cause. 1. Bacterial meningitis requires immediate hospitalization and intravenous antibiotics. Corticosteroids may also be used to reduce inflammation. 2. Viral meningitis, often self-limiting and treated with rest, fluids, and pain relievers. Antiviral medications may be used for certain viruses, like herpes simplex. 3. Fungal meningitis, treated with long courses of high-dose antifungal medications. 4. Parasitic meningitis, treatment varies based on the specific parasite involved. 5. Non-infectious meningitis, focuses on treating the underlying cause, such as discontinuing the causative medication or managing autoimmune disease. Prognosis. The prognosis for meningitis varies widely based on the type of meningitis and the speed of treatment. Bacterial meningitis can be fatal or cause serious, long-term complications, such as hearing loss, cognitive impairment, or neurological damage, if not treated promptly. Viral meningitis typically has a better prognosis, with most people recovering fully. Fungal and parasitic meningitis can be severe, particularly in individuals with compromised immune systems. Preventing meningitis involves several strategies. 1. Vaccination. Effective vaccines are available for many of the bacteria that cause meningitis, including meningococcal, pneumococcal, and Hib vaccines. 2. Hygiene practices. Regular hand washing, avoiding close contact with infected individuals, and practicing good hygiene can help prevent the spread of infections. 3. Preventive antibiotics. For those who have been in close contact with someone with bacterial meningitis. 4. Avoiding contaminated water, for preventing parasitic meningitis from amoebas. Epidemiology. The incidence of meningitis varies globally. Bacterial meningitis is more common in certain areas, such as the meningitis belt in sub-Saharan Africa, which experiences frequent outbreaks. The availability and uptake of vaccines have significantly reduced the incidence of bacterial meningitis in many parts of the world. Meningitis remains a critical public health concern due to its potential for rapid progression and severe outcomes. Ongoing research aims to improve diagnostic methods, treatments, and preventive measures to reduce the burden of this serious disease.